Welcome to Module 3 of our prescription reading course. Today we'll learn how to identify dosage forms and routes of administration, which are crucial for ensuring patients take their medications correctly. Understanding dosage forms and routes is vital because giving the wrong route or form can lead to treatment failure or even harm. Prescriptions may specify tablets, capsules, syrups, or even creams. Always confirm the correct form before dispensing. Doctors often abbreviate these forms, so memorize them to avoid confusion. Routes describe where and how the medicine goes into the body, which is just as important as the medicine itself. Make sure to check route abbreviations carefully, as giving a medicine the wrong way can have serious consequences. Here's a real-world challenge. A doctor prescribes amoxicillin 250 milligrams TDS for 5 days, but writes it as amoxicillin 250 milligrams TDS times 5 days, without specifying how many milliliters of syrup to give. You must calculate the total volume yourself, since 125 milligrams is in 5 milliliters. 250 milligrams equals 10 milliliters. So 10 milliliters 3 times daily for 5 days means 10 times 3 times 5 equals 150 milliliters total. You would dispense a 150 milliliter bottle, label the correct dose, and counsel the patient. Next scenario, a prescriber writes, paracetamol suppository 125 milligrams, PRTDS for a child. But in your pharmacy, you only have 250 milligram suppositories. Paracetamol suppositories can be cut lengthwise to achieve half the dose, since the drug is usually evenly distributed in the base. You would check the manufacturer's leaflet to confirm it is safe to divide, then counsel the parent to insert half of the suppository each time. Also explain proper storage and handling. A doctor writes, apply miconazole topical BID for 7 days, but does not specify whether ointment or cream. In your pharmacy, you have both forms available. The decision depends on the skin condition. If the lesion is dry, scaly, or on thicker skin, an ointment is better because it is more occlusive and hydrating. If the lesion is moist, weeping, or in a skin fold area, a cream is better because it is lighter and less greasy. You would also check with the patient about skin type or preference if needed. Final scenario. A doctor prescribes omeprazole 10 milligrams once daily, but you only have 20 milligram capsules. Should you advise the patient to open the capsule and divide it? Answer: no. Capsules generally cannot be divided like tablets. Omeprazole capsules are designed for controlled release. You cannot reliably divide the contents in half. You would contact the prescriber to see if a 10 milligram capsule is available or switch to another formulation. Okay, pause the video and decode this prescription. Diclofenac 50 milligram suppository to be inserted rectally at bedtime for 5 days. Great job! In Module 4, we'll break down frequency and timing codes on prescriptions so you never miss a dose instruction. Subscribe and turn on notifications to keep learning with me.